Bismillahirrahmanirrahim. Now we will be discussing at how to find a lesion in the vertebrae based on your physical examination, and we will be using the spinous processes and the transverse processes as the guide. So here you can see on this lateral view we can clearly see the spinous processes of L3, L4 and L5. So there is some gap which is called the interspinous space, and this is present between the vertebrae. Now what happens that in a normal person the spinous processes are aligned with each other. Let's assume that one of the spinous process is rotated to one side. Here you can see that this spinous process is rotated to the right. Now we do not talk about the position of the spinous process directly. Okay, when we say we want to describe the vertebra, then we need to discuss what is happening with the vertebral body. Okay, so if it is moving to the right, then the vertebral body is moving to the left, so we will call it as that the vertebra is moved to the left. So left rotation on L3 as compared to L4, because this is a motion segment between L3 and L4. So that's how you classify it. So this is just an example of rotation. What happens if there is side bending? So let's assume that if there is side bending of L4 over L5, what will happen that the spinous processes will be tilted and the transverse process between the two vertebrae will be approximated, and the gap between the two these transverse processes will be reduced, while on the other side the gap between the two transverse processes will be increased, and the spinous process will not lie in the vertical plane, but it will be a bit tilted. So it will be tilted towards the side of pathology. Let's say this will be left side bend and this will be the right side bend based on the position of the spinous process. So what happens if the vertebra is extended or fixed in extension position? So if it is fixed in the flexion position upon the passive accessory intervertebral motion testing or PIVM, passive intervertebral motion testing, the gap, for example, if it is fixed in flexion, the gap will not be reduced. So we will say okay, that in these particular vertebrae or in this motion segment this is flexed. But what if upon flexion the gap between the two spinous process is not increasing? So we will call it as it is extended. So that's how you classify your patients into FRS or ERS based on the position of the spinous process and based on the position of these transverse processes. Of course it requires a bit of practice and expertise to understand this, but if you keep on watching this video again and again, and if you keep on doing this what I'm doing here, you can choose some models, or you can use some wooden blocks, or you can even create your own models with paper. So you can practice this, and I hope you will learn this and master this. Thank you very much.